Our next patient is dealing with hypercalcemia. Whoops. Hypercalcemia. And this is when there are blood levels of greater than 10 milligrams per deciliter of calcium in the blood. So what does this individual look like? Well, they look and feel quite sick. And in terms of overall body, they tend to be on the weight loss side of the scale, and really have the appearance of not feeling well at all. These are individuals who have nausea, anorexia, and actual vomiting. At the same time, they're dealing with a loss of appetite. They're also dealing with increased thirst, which, as you can imagine, will only make that nausea and vomiting more likely. In terms of their cognition, these folks are confused. And the confusion can progress to bizarre behavior and even acute psychosis. So lots going on in terms of these individuals needing safe environments. Let's talk about the heart. Their contractility in the heart muscle is decreased. So these are the individuals who are at risk for
heart block
when you're observing their EKG changes. And it can certainly lead to cardiac arrest. In terms of their kidneys, you've got an overall increased output going on, and the urine itself is quite full of calcium that's trying to be excreted by the kidneys that are filtering them, and it increases the potential for renal calculi, kidney stones. The muscles are weak, and right along with the confusion, this puts them at great risk for falls. All in all, you have to think, what are the nursing actions? Well, decreasing the calcium intake from all sources, either supplements or diet sources such as your dairy products, dark green leafy vegetables, administering loop diuretics such as Lasix to promote the excretion of calcium, providing the safe environment based on what we're concerned about with their confusion and their risk for falls, and when it's appropriate, providing weight-bearing exercises, and of course treating any underlying malignancy which may be occurring in the bones, which we know is associated with destruction of bone tissue causing the hypercalcemia to end up in the blood.